Hey, my hardworking nursing students, it's me, Nurse Athena of Soft Nursing again, and welcome back to our Soft Nursing Pediatric Disorders. And today we're going to be talking about Hirschprung disease in a nutshell. What is Hirschprung disease? So, Hirschprung disease is the absence of a particular nerve cell in the colon, the distal part of the colon that connects to the rectum. And this nerve cell is called ganglion nerve cell. This nerve cell is responsible for automatically pushing the stool out of the body, pushing the stool from the intestine, from that colon down to the rectum and out of the body. It does this automatically whenever any human being want to do a number two, want to have a bowel movement. This ganglion cell is responsible for pushing your stool out to the rectum and outside. Okay, so during child's formation in the womb, in the mother's womb, this is where this takes place. This formation takes place, but unfortunately for our child having Hirschprung disease, this ganglion nerve cell did not form or is missing or something happened to it, but we don't have this nerve cell. So what are the signs and symptoms of Hirschprung disease? How do we know that our newborn has a Hirschprung disease? Number one, within 24 to 48 hours, they are not going to pass meconium. That's baby poop. They are not going to pass it. Because this disease causes the child to be constipated. So there will be so much stool in there that they cannot pass it out. The child is going to have distended abdomen. Obviously, their stomach will be swollen. Let me use the literal word, right? They will be throwing up. They could be vomiting and they could be having fever. As the child start growing, the child will be malnourished because when they cannot really have that bowel movement, what could not happen to the child? They will be malnourished because they're not going to be eating well. They will be malnourished. These children will have severe chronic constipation, and when they pass through, it's going to be like ribbon-like kind of stool. So keep that in mind. On your exam, you will see ribbon-like kind of stool. That is Hirschprung disease. They will have stunted growth because they're having nutritional defect. So they will have stunted growth as well. They will be having severe fever, abdominal pain, and bloody stool. So when they start having bloody stool alongside with fever and abdominal pain, yes, they are getting to the stage where they are having enterocolitis, and this is an emergency. Yes. So how can we diagnose this patient? Contrast enema, and the diagnosis is confirmed through rectal biopsy. So how can we actually treat this? So the treatment is normally through surgery. So the surgeon will go in and cut off that area that does not have a ganglion nerve cell. Cut it off and then join together the good part of the intestine, the good part of the colon, join it together with the rectum. In most cases, they will put a colostomy for this child. Most children heal very quickly and start having normal bowel movement, and they stop using the colostomy. So how do we nurses care for this patient? What is going to be your nursing intervention for this patient? Number one nursing action is that, especially pre-op, you're gonna make sure that you're monitoring this patient for enterocolitis, which is the dangerous part of this Hirschprung disease. That is when the child start having bloody diarrhea, fever, and abdominal pain. And then during surgery or after surgery, of course, you're going to be monitoring the colostomy bag. You're going to be monitoring the child for any changes at all. You're going to provide support for the child and the parents. Of course, you're going to be assessing their temperature, checking their temperature if there's any changes, assessing their skin, assessing the area where they had the surgery. You're going to be assessing for this child's general status after the surgery. You're going to be assessing their bowel sounds and their bowel movements. And remember that assessing their input and output is also important. So in summary, Hirschprung disease is the absence of a ganglion nerve cell, the nerve cell that is responsible for pushing out stool from the colon down to the rectum and outside. So during the formation of the child, this ganglion nerve cell is missing, or it did not form with the child. So this is making the child to have constipation or impacted stool. The child, within 48 hours of their birth, they will not pass meconium stool. And one big thing that we are monitoring this child for is for this disease process to not progress down to enterocolitis. And also, when you're assessing this child, when they start passing stool, their stool could be looking like ribbon. And this child could be going from having diarrhea to having constipation, and should be monitoring them for bloody stool and abdominal pain and fever. That will tell you that the child is having enterocolitis. And the only solution is surgery to cut that part off and connect it back with the rectum.